husband and I have one son, Joseph. He's 5.5, and he's been wearing hearing aids just about a year now.
My son Anthony, he was diagnosed with a hearing impairment.
So Ava's 5 years old, and she's had a hearing aid now for about 6 months.
My daughter Colleen has been coming to Fort Jeff Speech and Hearing for about 6 years now, since she was 12.
I've been coming here probably for about 18 or 19 years. I think I was diagnosed at 2 years old.
How old are you?
5.
5, wow.
Well, I think I got it in kindergarten.
At first it was a little bit intimidating because there was a lot for mommy and daddy to learn, obviously.
You don't equate a 12-year-old with needing hearing aids.
So it was difficult for me. I think it was more difficult for me than it was for Ava.
As a child, having a hearing loss, it was difficult. Especially not really knowing how to handle me in terms of like, they didn't know if I was going to become successful, if I was going to be able to speak English very well, how was I going to do in school. But I was able to defy those odds.
It was also a little bit heartbreaking because the transition was so seamless. He must have really been suffering because he put them on and that was it. He never looked back.
Do you like your hearing aids? Why? Why do you like your hearing aids?
Because then I can hear better.
You can hear better? You like your hearing aids because you can hear better?
Well, it can help me hear. Like my friends,
Okay.
my teacher. It's very pretty.
Oh.
And it's pretty cool.
Immediately following getting the hearing aids, his teacher called me all excited because she noticed right away the difference in his speech, his paying attention and understanding, and of course his expressive language.
And I think that we've definitely seen an improvement with her overall speech and language development, but most importantly, her confidence.
During high school, I felt like a lot of people were like, oh, well, I know you want to do this, but I don't think you can because of your hearing loss. And I would basically be like, no, I can do this. It doesn't matter if I have a hearing loss, I can do anything I want to do.
People that haven't seen him in a long time, they'll come up to him and say hello, and he'll start a conversation and be able to, go back and forth with the reciprocal conversation. And they tell me that it's unbelievable the change in such a short period of time since he's had the hearing aids.
Bringing out the child, I think the child's involvement is very important because you don't want them to think that this is who they are. I mean, these are his ears. That's what we tell them.
Why did you pick red?
Because it's my favorite color.
Your favorite color?
Pink.
Why do you like pink?
Because, well, as I was growing up,
Right.
I really like pink.
And I think their involvement is very important because it gives them a sense of ownership, that there's nothing wrong with it. This is who he is.
In terms of friends, you've got to be straight up with them, and if they don't accept who you are, then they're not your friends.
I mean, I have talked to other parents about it to tell them, not to feel, I don't know what the word is, maybe a little gun shy, because you're afraid that, there's some stigma attached to it, or that, there would be teasing or anything like that. We just always sort of, discussed it with Julia as her super ear. She needed it to help her hear, and why wouldn't she have something that would help her? And that's exactly how she describes it.
I would recommend bringing a child to see Dr. John Martinetti because he's definitely had many years of experience, but he really knows what he's doing. He knows what he's talking about. He's compassionate towards his patients, very understanding. Overall, just a very good doctor.
In terms of your practice, I think it's very personal. It's family oriented. It's kid friendly. I've called here dozens of times. Michelle, Valor, everyone's wonderful. It's very interactive. The parents are involved, which I think they should be. And it's comfort. It's a comforting environment.
Dr. Martinetti took all the kids to Build-A-Bear one time, and they had a great time. And Colleen, when you say we're coming here, we're not going to see Dr. Martinetti. We're going to see friends.
My favorite moment was when it was finally fitted. Remember when we came here? And then when you turned it on, the smile that spread across her face because she could finally hear those littlest sounds that she was missing.
That's wonderful.
My favorite moment.